Over the last 2 years, we've had challenges, particularly with the supplies for commodities for controlling HIV, from the medication, test kits, and the latest we need to address is the condoms. The need in this country is about 455 million condoms for the total market. When we say total market, we are talking about condoms that are free for distribution, which account for the greatest number, over 80%. Condoms which are socially marketed, which account for the other bigger number, about 25 to 27%. And the 3% which are condoms for commercial sales. The price of the socially marketed condoms have moved from 30 shillings to about Kenya shillings 100. Aware of the prevailing economic situation, this 100 shillings is a lot of money for most of the vulnerable people to buy. For the first time, this country has, over the last 10 years, this country has increased the number of new infections. The year 2021 to 2022. This is the first year in the last 10 years where the numbers of new infections have gone up. The next thing is that this is also the first year that we have seen the number of people dying from HIV-related causes increase over the last 10 years. So we are already starting to see. The other thing we have already started seeing, the number of children who are born, mothers who are HIV infected, the number of children getting what we call vertical infection are also gone up in, I think, like 17 counties in this country. It is estimated through a paper that was published sometimes in the past, I think 2017, it is estimated that as a country, Kenya would have the following benefits from having sufficient supply of condoms, particularly the free for distribution condoms. That we would prevent unintended pregnancies, 60% of which are teenage pregnancies, 5 million in 10 years. So we are looking at about preventing almost 600, we are looking at preventing about 600,000 teenage pregnancies per year if we have sufficient supplies of condom. We know what happens with the unintended pregnancy. The girls are under pressure from parents, from society, sometimes even to procure unsafe abortions. Not only the loss of the child from school, we also risk losing these children. Number two, for the other thing is the condom. During the next 10 years, sufficient supply of condoms is expected to reduce or prevent 840,000 new infections over a 10-year period. This one, we are looking at reducing nearly 1 million infections of HIV in this country. Without sufficient supply of condom and HIV prevention, part of the HIV prevention package, we are looking at nearly doubling the HIV burden in this country from the 1.4 million that are there to nearly 2.2 million people infected with HIV. And finally, effectiveness of condom in STIs. We expect proper use of condom, sufficient supplies will prevent between 600 to 1 million STIs in Kenya prevented over every year, without which we will have these infections and the government and the people concerned will spend a lot of money. The shortage is occasioned by several factors. Number one is that since Kenya was gazetted by the World Bank as a low as a middle income country, then we lost the support we were getting from donors, and therefore a significant amount of the funding that was coming to HIV, including for buying of and distribution of condom, was lost. Number two, A lot of donors, and this is very important, a lot of donors have declined to continue providing condoms to Kenya because the government has several taxes for importing and distributing condoms in this country, including clearly labeled free for distribution.